This lecture is on the kidney threshold level. So, most substances have a kidney threshold level. And if blood concentrations of a given substance exceed this level, then no more reabsorption will occur and the remainder of the substance will remain in the urine. Basically, reabsorption is costly. So if your body has enough of something, then it will not use the ATP to pull more of it back into your circulatory system. So this is what happens with diabetes. And in this case, I'm talking about diabetes mellitus, the kind having to do with sugar. So what happens in diabetes is that a person's blood glucose levels become so high that the remaining glucose in the filtrate simply remains there. So you have blood glucose going into the filtrate, of course, but since blood glucose levels are already very high, reabsorption of the glucose out of the filtrate back into the bloodstream doesn't take place. So as I said, the remaining glucose in the filtrate stays there and gets passed out with the urine. So then there can be other problems then having to do with kidneys. So when substances crystallize out of the urine, these are called kidney stones. So this is a natural process. In chemistry, maybe you have grown crystals or you have done precipitates where you have seen clear fluids that then wound up having little hard things precipitate out of them. This is basically how kidney stones form, and it's not always going to happen to people, but as I said, it's just basically a chemical reaction. So you get kidney stones. If these little stones then are small, these can pass out along with the urine. If they are large, these must be either surgically removed or shattered. And these days we can shatter them using either lasers or sound waves. Now, a different sort of a problem then is if both kidneys fail, an artificial kidney machine can be used to clean the blood. And this process of being hooked up to a machine so that your blood gets cleaned, and this process is called dialysis. And well, dialysis is a lot better than dying. Lots of people have this process done. If people have two kidneys that fail, they do need to go in for dialysis on a routine basis. But on the other hand, a person can stay alive and have an otherwise pretty ordinary life, even if they are dependent upon dialysis. And that is the end of this lecture on the kidney threshold level and other problems having to do with the kidney.